Okay, the third criterion, once again, new case, work-related new case, and meets the general specific recording criteria. And this is going to be those criteria. And so we'll kind of go through these specifically, but I wanted to look at this. The first one's death, obviously. We do have to record this, and we do have to contact OSHA within 8 hours to notify them that there has been a death. And we've talked about that, I think, previously. For days away from work, this is where the employee is not going to be at work. And so we need to make sure that, that if they're at home or they can't, if they're in the hospital or something like that, then we would have to record that as days away from work. So they're physically not at work. Any type of restricted work is going to be restricted will be that they are they can't do their normal job, in a sense. Like they may have a restriction of lifting their weight, or they can't use their hand, or they can't stand, or they must sit, or something like that. And that's going to be some restricted. That's going to be designated by the doctor, and the doctor is going to say that they cannot do this. And so it's definitely something that we need to look at. And when we look at restricted work, that's going to be doing one or more of their functions, routine functions that they cannot do. Transfer, we essentially are going to transfer them for a part of the day, or it's going to be a full day. They're transferred to another job. Typically, restricted and transferred are going to be together. And then medical treatment beyond first aid, and we'll talk about that here in just a second, as well as the last two here as well. Okay, so death, once again, we must call OSHA, and we've got to notify them within 8 hours. And obviously, they're going to come out and investigate this. And as I mentioned previously, that was one of those criteria. That's going to be their number one reason why they're going to come out and investigate. The days away from work, we talked about that. The employee's off work. This is going to be a doctor's recommendation. And if a doctor says that the employee must be off work for 2 weeks, and even if that employee is feeling better, they do have to have a doctor's note, and we should require them to have a doctor's note to come back, because we're following specifically that doctor's criteria and their recommendation. Loss of consciousness, that was one of them we didn't talk about. It has to do with any type of work-related. If we do a blood test, if we have a vaccination that they have to do, or if something happens within work that makes them, like if they slip and fall, they lose consciousness at any point in time. We do have to record that. If it's during a voluntary activity, then no, we wouldn't record that on there. If it's a diagnosis of a significant injury or illness, it can be any type of bone breakage, major burns. It can be punctured eardrums. It can be occupational diseases or illnesses, any type of work-related cancers, anything like that. Those would be definitely under that general recording criteria. And then significant injuries that need to be recorded, that we do have to make sure that we put them on that 300 log within 7 days of diagnosis. And that's something that they require. Once again, if you have it on your Excel spreadsheet, it's not going to be too hard to do that, but you do want to make sure that you're taking care of that. Restricted work, we talked about that, as well as job transfer, and then medical treatment, we do need to speak with regard to that. So just to, well, and I'm not sure why this is in here on that, so take that out. So this is your medical treatment, and it's easier to answer what's first aid versus what is medical treatment, because they specifically lay out this is first aid, it is not medical treatment, and so we'll kind of go through that. First aid essentially is administered by a layperson, a person who's not specifically trained in that, as a medical doctor or nurse or something. It could be a one-time short-term treatment. And essentially, we're trying to keep things from getting worse, so that we're kind of preventing something from getting worse as they go to maybe see a doctor or a nurse or something like that. So once again, this is precautionary measure. with regard to any type of first aid. But when we talk about administering oxygen, this is also going to be first aid if it's just precautionary. If we just give them oxygen just so that they can breathe easier, it's not required that they have that, then it would be precautionary. If we do require it to sustain life, then it is a recordable, and we would look at that. So this would be, if it's a first aid treatment, it's a precautionary. If it's medical treatment, it's going to sustain their life. They've been exposed to some hazardous substance or something, and we're utilizing that as a medical treatment because of their symptoms, then it would be recordable. Burns, when we look at it, it doesn't really determine the, if it's recordable regarding the size or degree of the burn. So when we have a first degree burn or a minor second, typically those aren't recordable, but if they do need some type of medical treatment, some salve, prescription salve or something like that, then yes, those would be considered recordable. All third degree burns are recordable. So you got to kind of look at the circumstances around it and the burn type when we look at it and the percentage of the body, that type of thing. Over-the-counter drugs, and this is where a lot of times meaning doctors will prescribe an over-the-counter drug. It's like a non-prescription strength medication or a prescription strength medication, and this is where it gets into some specifics. If it's non-prescription strength medication, then no, it would not be a recordable. It wouldn't be under the criteria, but if it is prescription strengths and there's specific dosage of that, which I'm not going to go into, but I wanted to just mention that, then you know, we would record it if it falls under that. Also, too, if they hand out prescription packets, like just little samples, that type of thing, and a prescription, then it would be recordable. If they write out a prescription, regardless if the employee takes it or not, it would be under that general criteria. So those are some of those that we have on there. So now let's just talk a little bit about recording on OSHA logs. And once again, you can find these on your under modules. We do want to make sure that we number these, the case number 1 through whatever. We do want to put the employee's name. There are some circumstances where we would put, if it was a case where we didn't want the person's name or something like that, we could, you know, put privacy case down here. The job title, the date of the injury, and the date of the injury is actually the date that the person can remember that injury happening, if it's like an illness or something that happened, or if it's the actual date of the injury, not the date of reporting, that they report it to the employer. We look at that. Where did the event occurred? Try to be as specific as possible with this much space when we look at it. Describe the injury. Make sure that you talk about it. If it's your ring finger on your right hand, then make sure that you're stating that versus just right hand. So this is something that is admissible in court, and OSHA does look at this, and so you need to be very specific, and it needs to stir some memory with regard to this. You only check one box here. You only enter one amount here. Typically, if they have days away from work, it's going to be more egregious than the restriction transfer. And so typically we would go ahead and put the days away from work versus that. But if they only have the job restriction, we put that. And then the type of the injury, and it's the most significant. When we look at it, you know, what if a person does have some respiratory, but then they also have an injury, which is most significant, and then we would check whichever box that would be. But it's a lot easier to put this in Excel, because Excel, you have some information like outside the box over here, and that it wouldn't be on your form when you printed it, and that would be the easiest way to put your notes and that type of thing. Typically, if you are going to record something, it is going to have an accident investigation, and so you could make sure that your case numbers maybe match up with those or something like that. Maybe like 19- whatever month it is, and then you can put that in there. So whatever, you can do a lot of stuff with that case number. It just doesn't have to be 1 through whatever. So how to record days away from work, and this is kind of going in this here area. Just to kind of mention, the days away from work, you do count calendar days. And so it is not the days that the employee would have worked. So if they work only Monday through Friday, you still have to count calendar days, Saturday and everything. Also the same for restricted work. Both of these you would count the day after the injury. And so those are some of the specifics on that for days away or job restricted transfer. For all of them, we do have a max. The cap is 180 days, and you stop counting at 180 days, and this allows for that. If the employee does leave for a reason that's not related to the injury, they just quit their job because they don't like it, or they don't like their supervisor, or they get another job, then you would stop counting at that point in time. If the employee leaves because of the injury, then you would continue counting out how you kind of have to estimate how many days that you would put in that, and that would be kind of, you would look at your job restrictions or your days away that the doctor had stated, and that's how you would estimate those. To put a hearing related injury, when we look at that under the columns on the right of your, let me get over here, and this has to do with the hearing loss, we would look at it. This is the decision tree. And we would say, okay, and we talked a little bit about this in PPE, but they look at the average of the 2,000, 3,000, and 4,000 in both years, and did they have an average of 10 or more related to that baseline. And so you'd kind of look at this criteria with regard to that, and you have to make sure that it is work related, and that's the big thing. So with regard to any type of hearing issues, you do want to make sure that you're specifically looking at this. Don't record it just because the person says that it is. It has to have some criteria with regard to that. On this 300 log, once again, I do want to mention that it has to be posted February 1st through April 30th of every year. If it isn't, then it could be a violation. So you want to make sure that you're looking at that so that you can take care of that as well. How do I do this? Oh, there we go. Okay, I need to get used to that. With this also too, you want to make sure that your establishment name and address are on here. We also talked about your SIC code, so your industry code. If you don't know what this is, you can look at a previous year's code, or you can actually ask accounting. They would know on that. This employee information, this is going to help you figure your DART rates and such, but your annual average employees, so the number of employees, and then the total hours worked. And this has to do with all employees, part-time, that it could be seasonal, that type of thing. And then also I'd mentioned earlier that you want to make sure that they sign this and date it with the telephone number. And that you are posting it and then putting the year up here. So this does need to be posted, and make sure you're doing that properly when we look at it. Okay, so I'm going to go ahead and stop this here, and we're going to talk about DART rates and TRR rates with regard to calculation.